Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on in Southwest Florida? Today I want to talk about knee pain and what you can do to mitigate it. So first off, let's talk about what causes knee pain. I mean stiffness, really, because that kind of affects how we're going to think about it. So in a word, it's pressure. So, joints and any kind of space of the body doesn't really have extra space. So as soon as you increase fluid in an area, aka swelling, it's going to show up as stiffness and cause you some pain. So what can cause the swelling? So first of all, we got to sort of differentiate between swelling that you can see, which is outside of the joint, and then swelling that's inside the joint, which is technically called effusion. So it's kind of the effusion that I'm talking about that causes some of the stiffness and the inability to either straighten or bend the knee fully. So it could be something like a meniscus tear, it could be arthritis, it could be some cartilage damage to the back of the knee. And quite frankly, I don't think we know all the reasons why you can be stiff in the knee and what can cause it. But those are just a few of the things. But just know that just because there's a stiffness sensation doesn't 100% mean that you have tissue damage. So anyway, you always have sort of fluids exchanging in the body. So you got metabolic processes with waste, and then that fluid has to get squeezed out of the knee, and new fluids come in with new nutrition to the area. And if you have a backup somewhere in the system, this can cause an increase in the fluid in the knee. So what can we do about this? So movement is the thing to do. Well, let me back up. What you shouldn't do? You shouldn't do the RICE protocol. So that's the whole rest, ice, compression, elevation. So resting it just allows for stagnation. It just allows the fluids to sort of fester. And I used to treat a ton of knee replacement patients, which is probably the most inflamed a knee gets or swollen. And anyone will tell you sitting through a meal is brutal because just sitting there not moving for an hour or 2 hours, you just get super stiff. So resting it is not a good idea. In fact, if you got knee pain, stiffness, and you go on a flight or you drive down to Florida or something like that, that's usually when it's worst. So resting it's usually a bad idea. Icing it, so ice and cold are vasoconstrictors. So yes, you're sort of shunting the vasculature that brings fluids in, but that's not necessarily a good thing. And you're not really allowing for things to leave the joint. So that's also not a great idea. Elevation, compression. Compression I can kind of take or leave. I guess it kind of depends on how tightly you wrap things. But you don't want to, cut off blood supply. And same thing with elevation. You're just using gravity to not allow fluids to get there. So I don't think either of those are really a great idea. So what should you do? You should do pain-free movement. That's the key. That's the best thing you can do. So figure out some way you can bend and straighten the knee, even if that means reduced range of motion, just to actually get fluid exchange. So think of like the knee as a pump that you're just mechanically trying to squeeze fluids out. So probably the easiest thing you can do, as long as it's not super painful, is go for a walk. Walking is great. That's really what pumps the lymphatic system. I did a whole podcast with Perry Nicholson on the lymphatic system. It's super fascinating. Go back and listen to that if you haven't. He goes on about the lymphatic system. He's so well researched in that system. And the short of it is that system handles a lot of this sort of metabolic waste product. It does a lot of things, but that's one of the things it does. And if you get some backup in the system anywhere, it can create, some festering in that knee. So going for a walk, it's full body movements. You're going to be moving your lymphatic system. So that's a great way to reduce swelling in any given joint. If that's too painful, try biking. And I'm talking about a recumbent bike. And so my father has an old meniscus tear, and when his knee stiffens up, this is what he does. I talked to him. It works great. He just gets on a bike, and he lowers the seat as much as he can tolerate, because don't think of it as like you're going for a bike ride. Think of it as I'm using a bike and the pedals for range of motion. So lower the seat as much as you can tolerate, and use the non-painful leg to sort of push the painful leg around. Try to get all the way through the cycle. If you can't quite get all the way through, go back and forth. So don't do full revolutions. Just go back and forth, keeping it, relatively pain-free. And what you find if you do is 3 or 4, maybe in 5 minutes, that sooner or later you'll be able to get a full revolution because you're just mechanically squeezing the fluid out of that knee. So biking is probably my favorite way to reduce knee stiffness. There is a exercise that I like to use, actually probably even more than biking, and I will post a YouTube video in the show notes. So what this looks like is you take a firm ball of some sort. Lacrosse balls usually are go-to in physical therapy. You lay on your back, and you put that ball in the back of your knee, right? So then you grab your shin, grab low in the shin, and kind of squeeze the knee into the ball. So you're going to usually find some tender points. This is great, too, because it usually works out any little kinks in the muscle in the hamstring or the calf. And you're just going to compress down. So your knee is bent towards your chest, hands on the lower part of your shin, and find a tender spot. And then slowly do some circular motions to the ankle. Maybe go clockwise 10 or 20 times, and then counterclockwise 10 or 20 times. Do that for whatever it takes. A couple minutes, retest the knee, and then see how it feels. Usually that's a great way to reduce stiffness, and you'll get a lot of knee flexion back. One other point I forgot to mention earlier, what not to do, sugar. So avoid refined foods, refined white sugar. So if you have a sweet tooth and you're real stiff, it's a good idea to stay away from the sugar. We know that sugar, we find sugar in inflamed joints. So this can totally exacerbate the situation. So once you've sort of reduced the stiffness, use your knee as much as you can. If it's a step up, a squat of some sort, use it whatever way you can, pain-free. Start to load that joint. Get that joint used to movement. Part of the way the whole pain cycle and nervous system work is that the nervous system sort of becomes vigilant of the area. It sort of notices a change and sort of turns up the pain dial. So doing pain-free movement teaches the nervous system, hey, this is not a threatening movement anymore, and you can turn down the pain dial in that way. Okay, so let's say you're doing everything right. You've improved your range of motion with some biking or maybe that exercise I described, and you're starting to do some pain-free movement. Maybe you're walking, you're avoiding sugars, you're not icing. Then you start to have to ask yourself, what is the reason behind? So almost always where the pain is, if you look next door, you'll find the answer. So with the knee, you can look at your hip, you can look at your ankle. I find that most often there's an ankle range of motion issue. So if you can't dorsiflex the ankle very much, that's going to tend to change the position of the knee when you get out of a chair, if you squat. Genu valgus we call it. That's a knee kind of collapsing somewhat inward. Not necessarily a problem unless it is. So for some reason, for some people, this creates an issue. It does create a slight bit of torsion at the knee. Maybe that's the culprit. So more often than not, if you fix your ankle and really work on your mechanics, you can improve the function of your knee. So here's a question I get asked a lot too is, should I take some NSAIDs, some ibuprofen or something like that? As a physical therapist, we're not allowed to really give you a yes or no on that one, but I'll just tell you that something like an ibuprofen or a Tylenol, they're potent, first of all. Just because they're over the counter does not mean they're not strong. And they can do a number on your cardiovascular system, and they can actually really affect your gut microbiome. So I can't give advice, but if it was me, I try to stay away from those as much as possible. Anyways, that's all I have for you this week, a short one. Hopefully you got some value out of this. Check out the exercise that I put in the show notes. If you have any questions, reach out to me, info@dynamicnaples.com. Thank you. Why guess when you can test? Do you get hangry or crash after a carb-heavy meal? These could be indicators that there is a dysfunction in your blood glucose regulation. If left unchecked, it can lead to irreversible changes. If you catch it quick enough, you can make diet and lifestyle changes that will get your levels where they need to be. 88% of Americans are pre-diabetic and don't know it. Diabetes underpins many of the pathologies we deal with in this country, such as obesity, high blood pressure, heart disease, and stroke. For some reason, it is rarely screened with your physician, and if they do test for blood glucose, it's usually with an A1C or a fasting glucose, which can sometimes give you a false negative. NutriSense is a company that supplies continuous glucose monitors. We've paired with NutriSense to get you real-time data to see how your physiology responds to glucose. The NutriSense app lets you track your daily activity to see how food, sleep, exercise, and stress impact your glucose. You can log or import this data into the NutriSense app to see the effect on your blood glucose levels as soon as it happens. Use the code DrChris25 for $25 off your order today. Do you have unexplained pain, or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great tool to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's thyroid function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It is sent to you with free shipping, and you get your results in 2 to 5 days. No physician referral needed. Use the code DPT25 for 25% off. You can find links in the show notes. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.